Knowing where to go for medical care can save time and keep you healthy. Schedule a visit at Lukian's Family Care for your primary care needs like annual checkups, preventive care, and management of ongoing conditions like diabetes or hypertension. It's also the right place for minor issues that can wait a few days or for follow-up appointments. Choose our urgent care for injuries or illnesses that need a quick attention but are not life-threatening, like cuts, sprains, or sudden sickness when your doctor isn't available. It's also the best option after hours or on weekends. Go to the emergency room for life-threatening situations like severe chest pain, loss of consciousness, major injuries, or signs of a heart attack or stroke. LFCC Urgent Care, available now. No appointments needed. Evenings, weekends, and holidays. Visit us at number 8 Seahorse Road, Lukian Shopping Center, or call 688-LFCC.
Did you know that many cancers can be prevented? Obesity, which is excessive weight for height, is a common risk factor for most cancers. During your annual physical, your vitals are taken and BMI calculated to determine overweight or obesity. Your doctor also screens for cancers based on your age and gender. For example, women may be screened for breast, colon, or cervical cancer, while men may be screened for prostate and colon cancer. Unfortunately, not all cancers can be prevented, but if diagnosed early, you have a greater risk of cure. Having a healthy diet, restricting alcohol, not smoking, avoiding diabetes, and maintaining a normal weight are some ways to help prevent all cancers. Take steps today to improve your health. Schedule your physical and talk to your doctor about your risk for cancer. I'm Dr. Tiadra Johnson. Remember, your health is your wealth. Did you know that more than 1.1 million people die from road traffic accidents worldwide per year? In the Bahamas, death from road traffic accidents are amongst the top 20 causes of death. Some common reasons why people get into road traffic accidents include excessive speeding, driving while intoxicated, distracted while driving. Other reasons may include running the red light or not adhering to road safety measures. Some accidents may not be avoidable, but death is less likely when speed is not a factor and other safety measures are adhered to. So buckle up, slow down, pay attention, and drive with caution. I'm Dr. Tiadra Johnson. Remember, your health is your wealth.
Iron deficiency anemia occurs when there is not enough iron to make sufficient red blood cells, which are needed for carrying oxygen throughout the body. Common causes may be a lack of iron in the diet, chronic blood loss such as menstrual periods, or difficulty absorbing ingested iron. Common symptoms include shortness of breath, headaches, fatigue, dizziness, palpitations, brittle nails, hair loss, cold hands and feet, and abnormal cravings for ice, dirt, or paper. Management includes increasing food sources of iron and the use of iron supplements. Good food sources of iron include red meat, seafood, whole grains, nuts, dried fruit, beans, and dark leafy vegetables. Remember, absorption of iron is improved when taken with sources of vitamin C. My name is Dr. Karis Thompson Major, reminding you that your health is your wealth.
I'm Dr. Tamara Moss, here with some tips to help your kids beat the heat this summer. Keep them hydrated by encouraging them to drink water frequently, even if they don't feel thirsty. Offer water-rich snacks like watermelon, cucumbers, and popsicles. Dress them appropriately in lightweight, loose-fitting, and light-colored clothing made of breathable fabrics like cotton. Use hats and sunglasses to protect them from the sun. Plan cool, water-based activities like swimming or playing with sprinklers. Indoor activities in air-conditioned environments are also good options. Use sun protection. Sunscreen with at least SPF 30 protects kids' skin from harmful UV rays. Be sure to reapply every 2 hours after swimming or sweating. I'm Dr. Tamara Moss, and remember, your kids' health is their wealth.
Did you know vitamins are essential nutrients needed in the body to help with function? Vitamins can be absorbed by taking supplements or with a daily intake of fruits and vegetables. Your daily intake of vitamins can improve your vision, keep bones strong, boost cardiovascular health, support immune system, and assist in proper brain function. Depriving your body of vitamins can cause nutritional deficiency, leading to cancer, diabetes, heart disease, anemia, and even depression. Some signs of nutritional deficiency are slow wound healing, irregular heartbeat, hair loss, vision deterioration, and fatigue. It is important to include vitamins in your daily routine to prevent disease. If you wish to know which vitamins should be included in your daily diet or supplements, talk to your physician about it during your next annual physical. I'm Dr. Danielle Robinson. Remember, your health is your wealth.
Are you or your relatives suffering from dementia? Dementia is a group of symptoms that can be caused by changes in brain structure that makes it hard for persons to remember, learn, and/or communicate. In early stages of dementia, there's short-term memory loss and difficulty thinking clearly. In later stage, there's often behavioral changes like aggression, wandering, or other disruptive behavior. Even though this is not a normal part of aging, dementia normally occurs in older persons. Some causes of dementia may be identified and treated. However, the most common type of dementia, called Alzheimer's disease, has no treatment. Symptoms usually progress slowly, and medication may help with controlling symptoms. However, family members and caregivers play an important role in the health of persons with dementia. I'm Dr. Tiadra Johnson, urging you to seek help early if your relative is having signs of dementia, as their health is your wealth.
I'm Dr. Tamara Moss, here with some essential water safety tips for children. Children should have constant supervision when they are in or near the water. Avoid distractions like alcohol, phone calls, or reading. Have them learn to swim by enrolling them in swimming lessons as early as possible. Teach water safety and establish ground rules for playing in the water. Explain the importance of never swimming alone or without an adult, and warn them of the dangers of running near pools. Ensure children wear properly fitted life jackets when in or near open water, boats, or docks. Learn CPR. Early intervention can save a life. I'm Dr. Tamara Moss, and remember, your kids' health is their wealth.
Do you know that if a person has HIV and takes their HIV medications regularly, they can live a long and healthy life? HIV medications reduce the virus level in the blood to undetectable levels, and this prevents the spread of HIV to other sexual partners. This is one way to prevent the spread of HIV. However, there are other ways to prevent HIV. Besides abstinence and the use of male and female condoms, HIV PrEP and PEP are two other ways to prevent the transmission of HIV. Hence, HIV is both preventable and treatable. I'm Dr. Norad Morgan. Schedule a consult today and learn how to preserve your health, as your health is your wealth.
Did you know that there are more than 200 types identified human papillomavirus, or HPV? HPV infection is the most commonly sexually transmitted infection. Although most HPV infections are without symptoms and resolve spontaneously, persistent infection can lead to warts, anal, cervical, mouth, throat, penile, vaginal, and vulvar cancers. A history of multiple sex partners, initiation of sexual activity at an early age, not using protection or other sexually transmitted infections, an immunocompromised state, alcohol use, and smoking have been identified as risk factors for persistent HPV infections. Screening for HPV infection is effective in identifying precancerous lesions and allows for interventions that can prevent the development of cancer. Although there is no cure, vaccination has proven to reduce the incidence of HPV. If you wish to know more about HPV screening and vaccination, book an appointment to discuss with your physician. I'm Dr. Danielle Robinson. Remember, your health is your wealth. Men, are you having an issue with your sexual function? Erectile dysfunction, or ED, is when you cannot get or keep a good enough erection to have sex that is satisfying for you and your partner. It is normal to have ED once in a while, but if it happens a lot, you may have a problem. The most common cause of erectile dysfunction is not enough blood flow to the penis. Other things that increase the risk of ED include alcohol use, being obese or overweight, cigarette smoking or tobacco use, depression, drug use such as the use of amphetamines, cocaine, heroin, or marijuana, hardening of the arteries, high blood pressure, high cholesterol, low testosterone or other hormone problems, relationship problems, stress, some medicines, strokes, spinal injury, and nerve damage. Treatment for erectile dysfunction depends on what is causing it. If you have diabetes, high blood pressure, or high cholesterol, treating these conditions can help your ED. There are also medications that can help you keep an erection longer. If you have any questions about your sexual function, book an appointment to discuss your options with your doctor. I'm Dr. Danielle Robinson. Remember, your health is your wealth.
Did you know that heart disease is the #1 killer of both men and women? Yes, women are at risk of heart disease just as much as men are. In many cases, you have no symptoms of heart disease or they may vary. Typical symptoms of heart disease includes dull, sharp, or heavy pain in the chest, which may radiate to the arm. However, women may experience pain in the jaw, throat, or upper abdomen, and have with it nausea, vomiting, or fatigue. Like other chronic illnesses, most heart disease can be prevented. So schedule a checkup, know your blood pressure, cholesterol, sugar, and weight, and keep them under control. We know that most adult Bahamians are either overweight or obese. So let's take steps to be heart healthy. Get active, eat more fruits and vegetables, eat less salt and sugar, reduce alcohol, and stop smoking. I'm Dr. Tiadra Johnson. Remember, your health is your wealth. Men, did you know that as you get older, your prostate gland enlarges? The prostate gland is found in males between the urinary bladder, where the urine is stored, and the urethra, the tube that urine passes through. As the prostate gland grows, many men may experience symptoms which includes waking up more often to urinate, difficulty starting the urine flow, dribbling after urination ends, reduced strength of urine stream, and difficulty controlling urine leakage. Erectile dysfunction may also occur. More than 50% of men over the age 50 have the enlargement called benign prostate hyperplasia, also known as BPH. Even though BPH is common, symptoms may also be related to urine or prostate infection, diabetes, bladder or prostate cancer. In most cases, screening for prostate health starts at age 40. So schedule your checkup with your family doctor or urologist and learn how to keep your prostate healthy. I'm Dr. Tiadra Johnson, and remember, your health is your wealth.
Sexually transmitted infections, commonly called STIs, are on the rise. Although STIs are more common in younger people, older persons can acquire and transmit STIs also. Most STIs are curable, like chlamydia, gonorrhea, and syphilis, while others may be treatable, like HIV, herpes, and HPV. Not treating an STI not only promotes its spread, but it can also have serious medical consequences. I'm Dr. Norad Morgan. Get tested for STIs, including HIV, today, as your health is your wealth.
I'm Dr. Tamara Moss. As parents, we all want to ensure we're doing what's best for our children. Here are 5 tips for keeping your kids happy and healthy. Ensure your kids eat a balanced diet by giving them a variety of fruits and vegetables, whole grains, and lean proteins. Limit sugary snacks and drinks, and encourage healthy habits from a young age. Ensure that they get regular physical activity. Encourage at least 60 minutes of physical activity each day. Activities can include playing outside, riding bikes, participating in sports, or dancing. Make sure that they're getting enough sleep according to their age group. Establish a consistent bedtime routine and create a sleep-friendly environment by limiting screen time before bed. By following these tips, you can set the foundation for a lifetime of healthy habits. I'm Dr. Tamara Moss, and remember, your kids' health is their wealth.
Have you ever experienced heartburn? Heartburn is a burning feeling in the lower chest with a sour or bitter taste in the throat and mouth. Despite its name, not related to heart, but as a result of stomach acid reflux, leading to irritation of the esophagus. This usually happens after eating a large meal, laying down after eating, or eating lots of citrus, spicy, or greasy food. Other things that can make heartburn worse includes caffeine, carbonated beverages, smoking, pregnancy, obesity, and some medication. Heartburn usually lasts a few minutes to hours and may be relieved by sitting upright and taking antacids. Avoid and prevent heartburn by eating small, regular meals. Avoid late-night eating and food and beverages that triggers it. Quit smoking. Avoid wearing tight clothes and lose weight if you're overweight. I'm Dr. Tiadra Johnson. Remember that your health is your wealth.
Fevers can be very worrisome for parents. An elevated temperature of 100.4 degrees Fahrenheit is officially called a fever. But fevers are not necessarily a bad thing. On most occasions, this is the body's healthy response to fight an infection. To confirm the fever, you should use a thermometer. Once confirmed, it is important for you to remember that most fevers can be managed at home with the following interventions. Give lots of fluids and highly nutritious foods. Keep them at home. Give fever-reducing medication, dress in light clothing, and allow them to rest. There are instances, though, when taking a child to the doctor is not an option. These include children less than 3 months old with a fever, temperatures higher than 102 in children 3 to 6 months old. You should also seek medical attention if the fever does not respond to medication or lasts more than 1 day in children 6 to 24 months and more than 3 days in children 2 years and older. If the child has another symptom like rash, shortness of breath, or earache, they should definitely see a doctor. If you're not sure about whether you should seek medical attention, call your child's physician or nurse or your nearest community clinic. I'm Nurse Darrell Smith, and remember, your health is your wealth.
Family planning involves being intentional about the timing and frequency of pregnancies. In the Bahamas, unplanned pregnancies are estimated to be 70 to 80% of all pregnancies. Family planning is beneficial because it allows parents better control over the timing of pregnancies and the sizes of families. This allows better control over resources needed to care for their families. It can also decrease the risk for pregnancy-related complications. There are a variety of family planning methods available, both publicly and privately. These include oral pills, injections, the coil and implantable devices, patches, male and female condoms, as well as vasectomies or male sterilization and tubal ligation or female sterilization. Discuss your pregnancy intentions with your partner and your primary care physician. Learn how best to prepare your body for a healthy pregnancy. I'm Dr. Kara Thompson-Major, and remember, your health is your wealth. Sleep is the golden chain that ties our health and our bodies together. When we get sufficient good quality sleep, we see improvement in our immune systems, our learning, our attention spans, our creativity, and our memories. When we don't get sufficient good quality sleep, we increase our risk for making mistakes and having accidents. We increase our risk for diabetes, heart disease, dementia, stroke, and depression. So here are some tips for healthier sleep. Go to bed and wake up the same time every day. Use the hour before bed for quiet time. Before bedtime, avoid bright artificial lights from the TV, phone, and computer screens. Avoid heavy meals, nicotine, and caffeine before bedtime. Spend at least 15 minutes outside daily and be physically active. Remember, prioritizing sleep is good self-love. I'm Dr. Kara Thompson-Major, and remember, your health is your wealth.
In 2018, the Pan American Health Organization stated that 6.8% of Bahamians were pre-diabetic. Prediabetes comes before type 2 diabetes. It means that your blood sugar level is higher than normal, but not high enough to be called diabetes. Risk factors for prediabetes include obesity, family history of diabetes, and a sedentary lifestyle. If you have been diagnosed with prediabetes, there are ways to prevent transitioning to type 2 diabetes. Prevention depends on your will to make lifestyle changes. One of the best ways to reduce your risk is by exercising. If you're not exercising now, set an achievable goal to start 2 to 3 days a week for 30 minutes. If you or someone you know is at risk for prediabetes, ask your primary care provider to screen you at your next visit. My name is Nurse Thorell Smith, and remember, your health is your wealth.
The month of September is highlighted as the Suicide Prevention Awareness Month. Suicide is complicated, but it can sometimes be prevented. Warning signs look like talking about wanting to die or wanting to kill oneself, talking about feeling trapped or feeling that there are no solutions to their problems, feeling unbearable emotional or physical pain, and saying goodbye and putting affairs in order. These signs should not be ignored, and help should be sought out immediately. 5 steps to help someone considering suicide. 1. Ask, are you thinking about killing yourself? 2. Keep them safe by reducing access to dangerous or lethal items. 3. Be there to listen. 4. Help them connect to the National Hotline for Crisis Intervention. And 5. Stay connected to the person so that they know someone cares. Be an advocate this month and every month of the year. This is Dr. Kia King-Strawn, and this is your reminder that your mental health is also your wealth. $3.5 to 5 million deaths are prevented every year from infectious diseases due to immunizations. This process is an important aspect of primary care and is when persons are made resistant to a disease through vaccinations. In the Bahamas, we provide immunization in early infancy to childhood to keep the population free from diseases. Common side effects from receiving immunizations are fever and soreness at the site of injection. If after receiving immunizations your child has any of the following symptoms, please treat appropriately with fever-reducing medications and pain medications. If your child has an allergic reaction to recent immunizations, present to the clinic or hospital to prevent worsening of the child's symptoms. Immunosuppressed children with low immune systems or children with recent moderate illness may not be able to receive all types of vaccines. Should you have any concerns about whether your child can receive an immunization, please feel free to contact your local community physician or NHI provider for more information and care. I am Dr. Kia King-Strawn, here to remind you that your health is your wealth.
E-cigarettes are electronic or battery-powered devices that heat a flavored liquid, often containing nicotine. Once heated, it makes an aerosol that is inhaled by the user. Persons also refer to e-cigarette use as vaping. E-cigarettes can look like traditional tobacco products like cigarettes, cigars, pipes, or even common gadgets like flash drives or pens. Some persons use e-cigarettes to help quit smoking. However, the safest way to quit smoking is to use a method that has been proven safe and effective, such as nicotine gum, lozenges, or patches. Despite the growing popularity, there are some health concerns with vaping. The presence of nicotine negatively affects developing brains, which are known to still be developing up to the age of 25. If you have any questions or concerns about vaping, please see your primary care physician. I'm Dr. Karis Thompson-Major, reminding you that your health is your wealth. Many of us have been prescribed medication to help manage an illness, whether short-term or long-term. It is important that you take your medication as prescribed, the right amount, at the right time, and the right way and frequency. Many patients don't follow instructions on how to take medications for various reasons. They did not understand or forgot the instructions. They were taking multiple medications with different instructions. The cost of the medications is a challenge, or they were experiencing, or even the fear of experiencing side effects will often prevent persons from being fully compliant with medications. Some ways to help with being more compliant include taking your medications the same time every day, tied with a daily routine like brushing your teeth. Always confirm whether it should be taken on a full or empty stomach. Use a pill container and refill it the same time each week. When traveling, be sure to carry extra in case your return is delayed. If you are experiencing any side effects, be sure to contact your physician as soon as possible. I'm Dr. Karis Thompson-Major, reminding you that your health is your wealth.
Many women want to know how they can screen for breast cancer. A mammogram is an X-ray of the breast. It is the most common screening test for breast cancer. You should have a mammogram every 1 or 2 years. It depends on your age and whether you have a high risk of breast cancer, like if your mom or sister had breast cancer. Your doctor can help you decide at what age you start and stop and how often you should get a mammogram. Many persons delay mammograms because of the lack of financial resources. However, if you are over 40 and have health insurance, mammograms are covered as a part of your annual health exam. For those without health insurance, many health facilities have special rates on mammogram screenings during the month of September and October. Take advantage of these special discounts. And then there are organizations like the Mammogram Access Program and the Cancer Society of the Bahamas that also help women to access mammogram services. This is Nurse Thorell Smith reminding you that your health is your wealth. Have your mammogram today.
Did you know that hypertension is known as the silent killer? Simply because you can have elevated blood pressure without having symptoms. High blood pressure is defined as systolic blood pressure of 140 millimeters of mercury and higher, or diastolic blood pressure of 90 millimeters of mercury and higher. Diagnosis requires 2 or more blood pressure readings on 2 or more occasions that meet the criteria for hypertension. Some risk factors for hypertension include having obesity or being overweight, alcohol use, increasing age, and a family history of hypertension. Diabetes and physical inactivity. Uncontrolled hypertension is associated with strokes, renal disease, heart attacks, and death. Typical interventions for aiding patients in reducing blood pressure include lifestyle modifications like weight loss, dietary changes, and increased physical activity, and also antihypertensive medications. If you wish to know if your blood pressure is elevated or if you meet the diagnosis requirement for hypertension, stop by your nearest doctor's office for a reading. I'm Dr. Danielle Robinson. Remember, your health is your wealth.